morning, Chairman. We're ready to begin.
Yeah, good morning to everyone and welcome. And Anisha, would you please call the roll of the board members?
Yes, Chairman. Norman Boyd,
Here.
Roger Folsom,
Here.
Russell Crutchfield,
Here.
I see you, Mr. Williamson. Can you make sure that you're unmuted?
Yes, I'm here.
Thank you. David Cruz,
Here.
Cynthia Rucker,
Here.
Melva Lee.
Here.
Thank you. Shane Mobley. Shane Mobley. Robert Coles. Robert Coles. Dr. Coles, I can see you. Can you please make sure that you're unmuted?
I'm not on mute.
Thank you, Dr. Coles. And for one last time, Shane Mobley. Chairman, that concludes my roll call.
Thank you, Anisha, and welcome everyone. We do have a quorum to conduct business and appreciate all of you being online this morning or on the call this morning to our meeting. We have a rather short agenda and we will move right into that. We will call the meeting to order. And the first item on the agenda is approval of the minutes for the August 11 meeting. And I'll ask Russell Crutchfield, our secretary, he's had a chance to review those minutes and would recommend approval.
Well, thank you and good morning, Mr. Chairman. I have reviewed the board meeting minutes from the August 11th board meeting and have found them to be in order. And I recommend that we approve the board meeting minutes from August 11th, 2022.
Thank you. Is there a second to that?
Second, Cynthia Rucker.
Dr. Ruckers has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, the minutes are approved. Thank you very much, Russell. As I said, our agenda this morning is really to address for a vote one item that we will discuss. This will be for an initial adoption. And with that, I will turn it over to David Cruz, Chairman of the Audit Committee. There was an Audit Committee meeting this morning. And David, would you please give us your report?
Thank you, Mr. Chairman. The Audit Committee met this morning to hear the FY 2021 audit results presented by the Department of Audits. We heard each of those findings and we heard the department's response to those findings. They were in agreement to the findings, and the department assured us that all the findings are being addressed appropriately and that the resources are available to address those findings. That concludes my report.
Thank you, David, and for the board members, and we appreciate this. Everyone has a copy, I think, of that audit presentation in the materials that you were sent prior to the meeting. So with that, are there any questions or comments from the board relative to the audit committee or the audit report? Hearing none, we will move to the next item on the agenda and the commissioner's report.
Good morning. Thank you, Mr. Chairman and members of the board. Just a brief update for me today. As you'll see from the agenda, it's only one action item today with new business from the department, but we'll be back in October with some additional action items and follow-up and final actions from our previous board meetings. But the team remains hard at work on working to implement several of the action items that we've taken since the end of the last legislative session and continuing to work on several of our major transformations and projects that continue, such as our Medicaid enterprise system transportation, our managed care reprocurement, and a few others. The team is continuing to have positive dialogues with CMS regarding our directed payment programs. And the next one that they're really in dialogue with in conversation is Georgia Strong, and we remain hopeful and optimistic about that eventual approval. Probably the biggest news of the last week is the announcement by Wellstar of the closure of the Atlanta Medical Center Hospital here in the city. We are working very closely with all the impacted parties, both Wellstar, the other Metro Atlanta hospitals, Grady, Piedmont Atlanta, and Emory Hospital, as well as the governor's office and his team, Mayor Dickens and the city, and representatives from both Fulton and DeKalb County. So we're working very quickly to assess the impact and what options there might be on how we, as a department, from a regulatory standpoint, ensure that there's an adequate transition plan and no interruption to quality healthcare access for those patients. So we'll be sure to brief the board as those actions and work continues, but the team is hard at work, and that's been priority number one for us recently. And then I just want to follow up with what I normally do and celebrate some of our staff milestones in September. Saminath Marathapan is celebrating 5 years with the department, as is Christy Washington, Kima McLean Hayes, and Derek Williams, and Herman Malone as well. Celebrating 10 years is Mary Jean Marks. Celebrating 15 years is Rachel Ann Barovich and Mary Cairo. And celebrating a 20-year work anniversary is Bruce Henderson. So again, we couldn't do the work that we do or serve the Georgians in the way that we do without the support and commitment of our staff. So thank you very much to those team members for their ongoing commitment. That concludes my report, Mr. Chairman, but happy to take any questions.
Any questions or comments from the board for the commissioner, please? Hearing none, we will move into the first item that we're asking to address today for a vote. And that the presentation will be done by Kim Morris, Director of Reimbursement. And so Kim, you may proceed.
Good morning, Chairman Board, members of the Board and Commissioner Nago. Today I'm presenting for initial adoption pending Medicare and Medicaid services acceptance, a proposal to change the disproportionate share hospital allocation methodology to increase the allocation basis for hospitals receiving directed payments through the state's directed payment program by the amount of any intergovernmental or certified public expenditure on behalf of the hospitals, effective for dish payment adjustments made on or after October 1st, 2022. There are no additional federal or state funds needed for this change. The change in methodology is to ensure hospitals participating in the state's directed payment program do not receive a reduction in their dish allocation. Chairman Board, I'd like to provide a little background on this proposal. The change in the disproportionate share allocation methodology was previously presented and adopted by the board at the May 13, 2021 board meeting, agenda item titled Medicaid Care Management Organization Directed Payment Programs to Public Hospitals for final adoption. The state plan amendment was submitted to Centers for Medicare and Medicaid Services, State Plan Amendment 21-0014. During its review of the state plan amendment, CMS stated that DCH needed to issue another public notice for the impact of the directed payment program on the disproportionate share hospital. The department is resubmitting this change in the disproportionate share allocation methodology to the board and issuing a public notice to meet CMS requirements. At this time, I will pause to see if there are any questions from the board.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Crutchfield will move for motion to approve.
Russell Crutchfield has made the motion for approval for initial adoption. Is there a second?
Dr. Lee makes a second.
Dr. Lee has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Kim, thank you very much. And I know that we appreciate the information that you gave us in advance, and we'll look forward to the public comment section, which you will report back on and make any changes for our final adoption
All right.
at a
Thank you
future
very
meeting.
much.
Thank you. With that, I have one item under the new business area. The last monthly meeting, we appointed a committee to review the officers of the board and make a recommendation. That committee being chaired by David Cruz and members Anthony Williamson and Dr. Nelva Lee. David, would you please give us your report? Has the committee met, and is there a recommendation for us on officer positions moving forward?
Yes, Mr. Chairman, the nominating committee has met and put forth the following nominations. Norman Board for the chairperson, Dr. Russell Crutchfield, vice chairperson, and Dr. Cynthia Rucker for secretary.
Thank you, David, for that report, and thanks to the committee for your work. I'd like at this time to move that to a vote on the slate of officers to the board. All in favor of this slate, say aye.
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 Aye. Opposed? Abstaining? Hearing none, the slate of officers are approved, and for the officers, I appreciate your willingness to serve in that capacity. We will be reviewing going forward. We'll be reviewing this, I believe, on an annual basis. So thank you all very much for attending today. Is there any other new business that you know of that needs to come before the board? Hearing none, the meeting is adjourned. Thank you very much.
Thank you.